Welcome back and thank you for staying with us. To Health Matters now, the Nigeria Center for Disease Control and Prevention says there is no specific treatment available for dengue fever. It therefore urged Nigerians, especially people living in Sokoto, to take preventive measures against the virus. Available data shows that prevention and control of dengue virus infection depends on vector control. Dengue fever is a viral infection caused by the dengue virus and transmitted to humans through the infected mosquito's bite. Human-to-human transmission of the virus has not been established. The Public Health Institute said most people with dengue fever have mild or no symptoms and will get better in 1 to 2 weeks if managed on time. To further discuss this, I am being joined by the head of Health Desk, News Central Television, Kelechi Okoro. Good afternoon, Kelechi, and thank you so much for joining me at this time.
Thank you so much for having me.
All right, so right now, why is it that, what are the reasons and why is it that there's no, prevention for the dengue fever at the moment?
Okay, so I would say it's the nature of the virus, okay? The dengue fever is transmitted by the female Aedes mosquito. For malaria, it's female Anopheles, but for this one, it's the female Aedes mosquito, right? And then it has 4 stereotypes, okay? And it's just hard to get a vaccine, to develop a vaccine that would address the 4 different stereotypes. And also, we also know that it is not, when you're treating the dengue fever itself, you're not treating the virus because there's no targeted vaccine, or sorry, there's no targeted treatment for it. So what you're treating are the symptoms. So just because, the stereotypes, there are 4 different strains, it's hard to, create a vaccine for, one vaccine that's going to take care of the entire stereotypes.
Okay, yeah. It doesn't really look good at all. Can you tell us if there's actually any ongoing efforts, in this particular area to come out with a vaccine? Okay,
so the ongoing efforts are towards getting a vaccine that would take care of the rest of them, and also they're thinking about antiviral drugs because it's a virus, it's a viral infection. So if there's an antiviral that can target that particular virus and deal with it, those are the things that are the developments in research in that area. But most efforts are towards vector control. Like we always say, when you control the vector, you control the infection. So if you're able to control the breeding of the mosquitoes or just the mosquito bites, vector control basically, it will go a long way to curb the dengue fever.
All right, now earlier you actually said efforts are being put more into, treating the symptoms of
yes.
the virus. Now, but can you explain what risks or even challenges is associated with solely, treating the symptoms of dengue fever, and not the virus itself?
Yeah, so treatment is not available, so you're treating just the symptoms. Now, there are bound to be complications because of various factors. For example, someone who already has a low immunity, it will be hard to control, the infection as against someone who has a good immunity and gets, infected. But someone who already has a low immunity would have more severe complications like the dengue hemorrhagic fever or the dengue shock, okay? And then also we have demographic groups like the infants, the pregnant women, people who already have low immunity, like I mentioned before, or living with other conditions that make them more prone to such infections. And also, so those set of people would have more, challenges curbing the progression of the disease. For example, you're treating symptoms, like I said, you have to do water replacement, you have to rehydrate, you have to treat, because the symptoms are like you're treating malaria symptoms. So sometimes there are no symptoms at all, sometimes they are mild. You could just overlook it like, oh, I'm just under the weather, I have the flu, and you don't go for any treatment. You know how Nigerians behave, we have very bad health-seeking behaviors. I know you're one of those people, or I am one of those people who would have, just feel funny and you just think it's stress and you don't go for treatment. So late diagnosis, late medical care would cause more complications, like I said. And I'm supposed to mention that there is something called the antibody-dependent enhancement. Okay. So when you've suffered dengue fever before, you're more likely to get infected again with another strain. So this time, when you get another strain, it becomes more complicated to pick or to treat. So these are why, some of the reasons why, you could have complications with treatment, or treatment doesn't, exactly.
Just the symptoms.
Exactly.
All right, now, how can, healthcare professionals prioritize resource allocation and patient management in rural areas like Sokoto, where, there's actually confirmed, they've actually confirmed the virus, knowing that, these treatments to this particular specific virus is unavailable?
Yeah, so I would always say education. A lot of resources must go to education, must go to disease diagnosis, at least picking up the disease for what it is, and also, supportive care. Okay, back to education. Some people do not even know. I mentioned dengue fever today, and somebody I spoke to hadn't heard of it yet. I'm like, okay, it's caused by mosquito. And like, no, malaria is the only thing that causes that you get from mosquito bites. So education, so that people know that this can be gotten from mosquito bites and then prevent it. Also, vector control, very important. There's no specific treatment for dengue fever, so vector control is very important. Mosquito-treated nets. Okay, this is not just for the medical professionals. On the healthcare provider, of course, education when you're seeing your patient, and on the government side, the health policymakers and all of that. So people need to know that vector control is really important. Mosquito-treated, insecticide-treated nets, mosquito repellents. It's not a thing here in Nigeria. I mean, everywhere else, people know about mosquito repellent creams. You're not just interested in just moisturizing your skin. If you're in an endemic area, if you're in a place where there's mosquito population, you should know that there are some creams that can repel not just mosquitoes, other insects. And also using breeding sites. We have breeding sites. Like I said, control the vector, and you control the infection. Breeding sites for mosquito has to do with poor sanitation, stagnant water. So if we are able to not provide those breeding sites for the mosquitoes, then,
keeping your environment
clean. Yeah. So then we will not have problems with having to fight the female Aedes mosquitoes that causes the dengue fever.
All right, so aside lifestyle changes and also, treating the symptoms of the dengue fever, are there any therapies, complementary or alternative therapies that have actually shown promising results in managing the dengue fever?
In rural areas, we have these in rural areas a lot, and we know that they use a lot of herbal, concoctions and herbal medications, but there's no substantial, evidence that this works. So like I said, it's symptomatic. Water, very important. Staying hydrated is very important. Also, one of the symptoms, the fever, very high fever. So controlling the fever, bringing down the fever is also a therapy that works. Tepid sponging, you don't really have to go, if it's severe, you can now do, antipyretics, that's the medicines for fever. But tepid sponging with blood, water and sponge all over the patient's body, it works too. And also, eating properly. Of course, poor nutrition would not let your immunity be prepared for, such acute infection. So good nutrition and rest, very important. When treating malaria, we all know that you need a lot of rest. Same thing, this is a similar, infection, although can cause complications like I mentioned earlier. You don't want those complications to happen. The hemorrhagic fever, where you have blood coming from all over the orifices of the body, is similar to Ebola. Those are one of the complications of the dengue fever. So you want to make sure you do everything to support your health at that time, so that, it's a self-limiting infection. It's a viral infection. It's self-limiting. Without treatment, you will get better. However, the symptoms can be, very uncomfortable, yes. So, and then like I mentioned earlier, some groups who already have low immune system, poor nutrition, the pregnant women and the children, yeah. So these set of people would really, really, really need to make sure that they treat and don't wait for it to self-resolve.
All right, well, thank you so much, Doctor, for joining us on the news and also enlightening us on this particular topic.
All right, thank you for having me. And remember, here at News Central, your health and your wellness is our concern.
Yes, indeed.
Thank you.